On the one hand, this talk is a little bit of a different direction. On the other hand, it does pull together many of the themes we've already talked about. And I hope you'll see that, particularly things around open-minded thinking, the type of coaching mindset with asking questions, some of the elements that Scott and Trish were talking about this morning, but a little bit more in kind of like a developing ways of moving the organization. And so we thought this was a good pivot point between talking about leading self and leading others and interacting with others, and then tomorrow's theme around leading an organization. And innovation and creativity can operate at different levels, but typically we're thinking about that how can we be creative and innovative in terms of what our organization is doing. And by organization, that may mean your team, or that may mean an entire large healthcare enterprise. That could even mean an entire country's healthcare system in terms of trying to be innovative in how one does work. So no disclosures again. So we're going to talk about creativity and innovation. We're going to talk about constraints to innovation. It's important to understand what stops innovation, what gets in the way, so we know how to overcome those constraints. And then thinking about some ideas for setting up for success. So what do we even mean by creativity? We throw this word around a lot. So when we look in an English dictionary, we come up with a word that creativity is the use of imagination or original ideas, especially in the production of an artistic work. That's often how creativity gets thought about. And in English, other words that get used are things like inventiveness, imagination. Innovation gets used to define, or another way of thinking about creativity, originality, individuality. And the other thought is creativity is a phenomenon whereby something new and valuable is created. So the idea is that if you're just rehashing something old, that's not really very creative. I'm interested in sort of how this translates into different languages. Are the sort of notions of creativity similar in different languages? How do you think about creativity in your languages? Yeah. Do we have the, were you meaning?
Like in our language, creativity should be original, you should be something unique, original, something that's not repeat new.
Not repeating new. Okay. And what's the word in your language? Remind us all about it.
Creativity. It's creativeness. It's
Okay.
almost the same.
Okay. Got it. Okay. So the same ideas, right?
Yeah.
New. Okay, good. Anybody else? Are there different sort of nuances, as it was, or connotations to that word? It feels about the same. Okay, good. Okay, what's that?
It's the same word.
Same. It's the same word. Same word. Okay, so it's borrowed. Okay. So why do we talk about creativity and leadership? New approach. Yep. Irene. Build a vision. Right. So it may not be if your vision was to do the exact same thing we always did, that doesn't seem like much of a vision, right? Okay?
It's like to make the colleagues' work maybe much easier, to bring up to different approaches so that they can use less time and have more.
Yeah, so being creative or thinking of new ways so that work is better, I think you said easier. Okay, good. Inform change. Okay, good. Okay. So there's a change and creativity feel like they should go together, right? If you're changing something, there should be something creative about it. Now, you might change to something that everybody else is doing. I mean, some of the changes people are talking about is, well, this is a standard. Everyone's doing it. It may not be creative of what the actual product is, what we're doing. But getting from here to there may require some creativity, the vision to get from here to there, right? And so there may be elements of not so much what we're doing, but how we're doing it could be the creative part, right? All right, so great ideas can come from anywhere in an organization. And so this is the connection to that coaching mindset. Talking to people, even if they're sort of in a hierarchical relationship with you, it's likely that, for example, the clerk at the registration desk probably has better ideas about how to improve registration than the CEO, right? But if the CEO walks in and says, I have an idea for fixing registration, and blah, 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 right? And the registration clerks are like, do you even know what my job is? Right? Can I tell you like what the connection is? It's not to say the CEO may not have a good idea, and they may actually they may have gone and been like, wow, our patients have a really bad time at registration, now I'm experiencing it. But it's very likely that great ideas are going to come from different parts of the organization, and giving them the spirit to be creative and thinking about how to do things differently is really important. Creativity acts as a platform for collaboration. So getting people together and saying, hey, like, we want to hear all your ideas, it gets people in the spirit of collaboration. They feel better about where they're working. Scott made a comment earlier about people are more likely to get behind an idea when they feel like it came from them. And there's this notion that, like, I actually don't care where the idea comes from. I want them to feel like they made the idea. And there's sort of ways of sort of getting that. And people are like, oh yeah, it was my idea. I was like, totally your idea. And they're like much more engaged, right? Collaborative, and engagement is a big word we use around sort of employee engagement. And this is one mechanism to get employees engaged in their organizations. They feel like they're making changes. It opens up different perspectives, right? Like going into a meeting and saying, we're here to create a new way of doing things, or we're here to create a way to get from here to some future state, gets people to open up, share perspectives, say, oh, I've had these different experiences. And sometimes we look at it from outside of healthcare. That can be really valuable in thinking about, oh, well, what was my experience in going to a restaurant and going somewhere else? I don't know if I shared it with this group, but it's probably about 10 years ago. I went to a food distribution center in Philadelphia. And the people there could not understand why I was coming to a food distribution center with a bunch of doctors, nurses, operations management people from a hospital. They're like, shouldn't we be coming to you to learn about how to like do things? I was like, no, actually, we have a lot to learn from you. And we did. And so, like, coming back and saying, like, what were the solutions that they use, and are there ways we can think about applying those in our work? There's intellectual challenge, and people can develop passion projects. Yep.
Have you visited the airline operations center?
Airlines, yes. So healthcare loves airlines, as we write. So there's a lot to learn from airlines, right? Not only in safety, but sort of how they do their operations. Yes. Yep.
Safety protocols.
100%, right. Breaking down hierarchies, particularly around safety events. Escalation, correct, absolutely. Yep. Intellectual challenge and passion projects, so people can really get passionate about something that they feel like they've been creatively engaged in. And then leaders can motivate, challenge, ask questions, and encourage all of this. And they're using the skills that we've already talked about, right? And so, some of these things are around that coaching mindset. Some of these things are about flexing maybe into a little bit more of an owl mindset of asking a bunch of provocative questions in order to get people to sort of put on their creative juices, as the phrase in English would go. So there are some distinctions worth talking about here, because the words sometimes get mixed up in their use, but we do want to talk about some differences here. So in invention, we typically think about as the creation of an idea or a method itself, and that may be something that didn't exist before, or something entirely new. Now, people think about, there's this legal idea behind inventions and patents, that it's got to be new enough that it's a very different idea. And while there are a lot of inventions out there, and people create entirely new things that they may or may not get patents about, oftentimes what we're talking about in this creative space is less about inventing something that's never existed before, which of course would be great if you can, but that may not be necessary in all regards, right? We can do really creative things, and we're going to talk about ways in which people have been incredibly innovative and they mix together things in different ways, they haven't invented anything that's never existed before. They're just using them in different ways. And so the emphasis there is on how things get done, not what gets done or what it is. And invention is a little bit more about the what. Innovation is focused on the use of a better or novel idea and method. And that's a lot of where we are in the healthcare space. How can we be innovative? We may not invent something new, we could, but if we innovate, we're really changing how we do things. An improvement is doing the same thing better. So lots of efforts around quality improvement, of course, and we want to distinguish those two things. Really, with quality improvement, we're trying to say, this ought to be done better. Now, sometimes there's an innovation connected to that improvement. We sort of go about the process and we realize it's actually really hard to consistently do this given how the room is set up, or what the rules are, or what the products we're using are. And someone might come along and say, we can do the same thing better, like hand hygiene, like we're trying to improve hand hygiene, but we may be able to do that thing better if we make some change to how we go about doing that, the process to achieve that goal. And so there are connections between improvement and innovation, but improvement is much more focused on the sort of doing the same thing. And so innovation then is doing something differently. And it may be that process to achieve a certain outcome. Is that making sense to people? Sort of these subtle differences between innovation, improvement, innovation, and invention. Okay. So there's important notions in innovation about figuring out what it is that the customer wants. And it's important to think about who our customers are. And so this quote is a Harvard Business School professor, and he said, people don't want a quarter-inch drill, they want a quarter-inch hole. So we go to a hardware store, right, and we buy a drill bit, right? Does anybody just want a drill bit? Has anyone gone out and been like, I need a hammer for the sake of having a hammer? No, right? You're getting a hammer in order to put a nail into a wall or something, right? And so his point is that we seek out things to have a goal in mind. We're trying to achieve something, right? And so think about who your customers are. Who are your customers? Patients or their families. Who else are customers? Students. Students may be a customer, yeah. Who else might be customers? Or you could think about it in the certain customers. Your colleagues, yeah, staff, right? And I often challenge people inside CHOP to think about others in the organization as customers, right? So information services, the customers of information services is maybe the patients, right, when they're interacting with our electronic health record from their homes or their devices. But most of the customers of information services are the 20,000 employees of CHOP. And so my challenge to IS is to think about us as their customers. What do we want? My goal when I wake up in the morning is not to enter a 20-digit password over and over again. My goal is to get information about the patients I'm taking care of, right? And so the challenge to them is how can we make it safe and secure that I can get what I need? Right? So Clay Christensen, who's also at Harvard Business School and was Levitt's student, said a customer has a job to be done and is seeking to hire the best product or service to do it. And innovating is about figuring out that best product or service, moving from one way of doing things, the how, to another way. Sometimes it might be a different what involved, often it's a different how, and we're going to talk about that. So what does a customer want to do? Do people want to ride horses? I mean, some you might, for recreation they might, right? But why did people start riding horses? Their goal was to get from point A to B, right? That most of that was not recreational. So automobiles replaced horses, right? Because it accomplished the job in a better way. Now there was the invention of the automobile, but fundamentally it was about a how. How do we move from point A to point B? Did people want to go to the library or get information? They wanted, right? They wanted information. Now, there's something special about going to a library. We want our kids to go to a library, but there's like the fundamental goal you have in mind. The customer experience there is to get information. So what do patients want? Are patients waking up in the morning saying, like, I really want to go to the doctor's office? That's why I woke up this morning. What do they want? They want to get better. They want reassurance. They want information. They want a diagnosis. They want to, get counseled about something, whatever else. And so, what have we seen? Telemedicine replacing in-person visits, especially through the pandemic, right? Accelerated this idea, right? And we see that all over the place. Most people didn't wake up and say, I really want to go talk to a bank teller, right? They wanted cash. So their ATMs replaced bank tellers, right? So it's all about this how and figuring out what people want. Now, sometimes innovation is what's called incremental. That is, we make small changes on our way, and when we look back, we're like, wow, look how far we are from how we used to do things. And that's actually a really valuable kind of innovation, and people should get credit. And the reason I start with this is that oftentimes people are looking for the big change, the invention, or whatever else. And sometimes, oftentimes that may be possible. It's great when it happens. But in healthcare especially, where progress may be slow, there's a lot of regulations, it's hard to change your built environments, things along those lines, small innovations can be really helpful. It also gets in the spirit of sort of ongoing improvement and innovation. And the idea here is that there are changes that lead to improvements in value, which is the relationship between quality and cost. So there's always this relationship between quality and cost. And the value proposition is not that it was expensive or incredibly high quality. It has to be the right quality for the experience. So who's either heard of or flown Ryanair? What was that experience like? Can someone tell me, what's it like to fly Ryanair? Cheap, okay. But what?
Not too comfortable.
Not too comfortable. But did you fly across the world on Ryanair? Did you fly like 10,000 miles?
Not 10 times, but very often.
Very often, right. But short, right?
Because
Short.
it's good for money.
Yeah.
You can save money, you can wait for
It's-
hours without a meal.
Yeah.
But,
Right. Would you fly to Asia on Ryanair? No, right?
Because they don't fly to.
Well, they don't, right? They do. But if they did, would you?
No.
No. Why?
Because too long flights is not
Comfortable, right.
It's
So the value proposition, right? You would say, now some people might say, well, it's worth it, right? But so the idea is that Ryanair is providing you a valuable experience. The quality, right, is short distance flight for a low cost. Okay? But when there's other things, I often talk to the residents about the qualities they're looking for in their graduation dinner are different than the qualities they're looking for in breakfast after they've been on call for 30 hours. I mean, they don't really do that anymore, but right. But like the point is, and they'd be annoyed, right? If their parents took them out for graduation dinner that looked like breakfast after being on call, they'd be like, what is this? I worked my butt off for 4 years in medical school, and you're taking me out for like, a scrambled egg and a piece of bacon, right? They would be like, what is that? And on the other hand, if they went to the hospital cafeteria and they got scrambled eggs and bacon and were told that will be $100, they'd be like, that's not the right That's not the right cost for the quality of what I'm being given, right? And so value is very much what does the customer want and the match between those things. And so innovation is about trying to improve value either by improving the quality of the experience or lowering the cost of the experience so that there's more of a match there. And this is where we get into something called business model innovation, which is focused on how we do things from the customer's perspective. Some incremental innovations are Gmail. So I saw a lot of so who used Gmail, right? Who used Gmail 3 years ago? 5 years ago? 10 years ago? 12? I don't know, whatever, right? Like, for people who've been using it for a long time, Is it the same now as it was 10 years ago? No, right? Did they invent something new? Did they invent something new, or they just kept, each time you logged on, it was like little bit, right? But now in 2023, if we could go back to 2013 or whatever came around and we looked at it, we'd be like, oh man, right? What would you think of it now? You'd be like, that's not a very good product, right? But they slowly made improvements to it. So they made the product better, they reduced their own cost of delivering it, and they kept checking what customers wanted, right? I'm sure they have focus groups and they talk to people, do you like this feature, do you not like this feature? Things along those lines, and they kept making it better and better and better and better, right? They didn't invent anything. Did they invent email? Did they invent the computer? Did they invent color codes on the screen, right? They didn't invent anything. They've just continually made it better and better and better, right? And delivered really high value. Look how many people here use it, right? Okay, so business model innovations are a novel match between a solution and a need, so value is created. And it can be either a transformation or a reinvention in something, all focused on value. So I already mentioned Ryanair in the United States. We have an airline that's similar, is called Southwest, although from what I hear, Southwest is a little more comfortable than Ryanair, but not much. No, I thought you were going to laugh or say something, or Scott was. And so rather than focus on what is produced, business model innovation emphasizes how the product is delivered. And it really changes the way it's supplied to deliver things often faster or better in some manner. It may not be that, it's not more luxurious necessarily, it's just better for achieving what the customer has in mind. And so that's a really important thing. Does anyone know Netflix? Has you heard of that? Okay, right. So what's Netflix? What was the original Netflix business? Discs, right? Discs and were they in Europe? Were they red envelopes or people? Right. So did Netflix invent the post office, the red envelope, the DVD? They didn't invent anything. They just packaged it differently. And do people know what business they put out? What company they put out of business? Blockbuster, right? So Blockbuster had come along with a new innovation of, here we've got these things called VHS tapes, we'll make it convenient how to get those to customers. Netflix comes along and very quickly puts Blockbuster out of business. Now, how has Netflix further innovated? What have they done in order to not be put out of business by somebody else? It's online, right? Like, I don't even know how many people still get the DVDs mailed to them. There's probably some people, but now most of their business has shifted. But again, they didn't invent the internet. They didn't invent any of those things. They just made a product different in order to meet the valuable needs. And they make a lot of money, right? People make $1 gazillion not inventing anything. And they deliver tremendous value to customers all over the place. On the other hand, from this incremental innovation idea is what's called disruptive or radical innovation. And these are bigger and sweeping changes that people really notice. They're like, whoa, that's like a major change. And something unexpectedly overtakes a market or disrupts or displaces a prior technology. And so, for example, the Ford Model T overtook the transportation market, or the iPod overtook the music market. Now, what's interesting here is actually when you tease some of these examples apart, they weren't necessarily the invention themselves. So the Ford Model T was not the first car, right? Ford just figured out a way to make them faster, cheaper, more reliably, and it overtook the market. The iPod actually has almost no unique new components to it. Steve Jobs and Apple just reassembled things differently. Did anyone hear of Rio? R-I-O, right? The Rio MP3 player? I actually thought it was better than the iPod. Who thought it was bad? Who had one? It was easier to use, wasn't it? I still don't know how to use an iPod, truth be told. And I would love to use my MP3 player. I was actually trying to find a Rio for my kids because I don't want them with all the extra stuff of an iPod. It's really hard to find, though. And so the point was, like, they weren't first, but they disrupted the market. And they had this sort of radical innovation, right? So the Rio was first, but the Rio didn't disrupt the market in the same way that the iPod did. Other cars came first, but didn't disrupt the auto industry as much. Often these things have novel, clever combinations of existing technologies, so the iPod, the iPhone, etc. There's not necessarily a new component, but they're put together in a new way. And the enablers of this kind of radical innovation are technologies that simplify a process, business model innovations that allow some sort of radical change to happen. So business model innovation can be incremental, but it can enable a radical change. And there can be a disruptive value network, meaning that you're able to distribute something in a very different way, right? So Apple figured out ways to sort of get these materials out to people in a different way. And that's the network part of it. People sometimes talk about radical innovation as this blue ocean strategy, which is a radical new way of doing something. Who's been to a Cirque du Soleil circus or heard of them? Yeah. What's interesting about the Cirque du Soleil circus? No animals. So who saw the circus set up in downtown Salzburg on their way over here today? It looked like one with animals, right? They're like the signs all had animals. So what are these people doing claiming they have a circus and they have no animals? How can they claim to be a circus? What's a circus? Oh, they've got acrobatics. Okay, so what's the dictionary definition of a circus? I don't even know, right? But the point is that why did people go to the circus? What were they going to the circus? Entertainment. So what they figured out was people were going to the circus to be entertained. They redefined what it meant. They said, we're going to entertain you with things that look like a circus. Big places, acrobatics, acts, music, all sorts of other stuff. But we're going to remove the most expensive part of delivering the product of entertainment. And one that also gets some people upset, right? Some people are just, not only is it expensive, but some people are object to the idea of animals being treated in that way. Super, super successful business, right? Totally changed what a circus even means. Yeah. Why is it called Blue Ocean? Yeah, so the strategies are often because they're like, it's very expansive and big, like a big change, right? You have this huge sort of expanse in front of you, like a blue ocean. So they sort of talk about it like it's so expansive that you're really making a big change. So where are some disruptive radical innovations in healthcare? Telemedicine, retail-based clinics. People will sometimes talk about disruptive. Do people have those in your home countries? Know what I mean by that? So like you go to a Target or a Walmart or a CVS, which is like a pharmacy type of thing, and there'll be there's like a window with a little mini office, and a nurse practitioner, sometimes a doctor, is in that setting, and they have a list of diagnoses they'll take care of, and they may even prescribe you a medication. And if they're in a pharmacy already, they'll write the prescription for you, and then you can conveniently go right next door to the pharmacist who can fill the prescription for you. Okay, so this is who likes retail-based clinics? Who do you think likes retail-based clinics in the United States? Patients may like it. Parents, Sunday morning, my kid has a sore throat, my primary care doctor's office is closed, I really don't want to wait in line in the emergency department, I really just need my kid's throat swabbed, because can they go to school or not tomorrow? Can I go to work or not tomorrow? So you go to a store, they swab your kid's throat, strep or not strep, here's your amoxicillin, you're all set. Not strep, the kid has a virus, go home, right? Who doesn't like retail-based clinics? Yep.
It's not about that I don't like it, but it's like in our country, like hospitals working 24/7. It's not just about the government. It's like a private sector. There is no problem, just it's in the morning and Sunday say like, okay, something wrong with my child. It's like, okay, there is like 10 or 15 options, just go and choose. I mean, it's more difficult in Europe just because you need to make a point, wait. I mean, in some countries where it's like hospitals a lot, I think Do we need retail-based clinics?
Yeah, but that's waste of resources because you're much more expensive than a trained person who can take a swab and give results and have the power to prescribe one type of antibiotics for that. Yeah, there are pros and cons for every approach, and there is a market for everything. But these things cascading down from hospital to outpatient, from outpatient to something else like reach-out clinics, retail-based clinics, or pharmacies, or whatever. That's cutting the costs down, because in 80 to 95% of the situations you can do it there. So initially, surgery was done only in hospitals. Nowadays, 40% of all surgeries move to outpatients, to day case, to same day, whatever you call it, however you organize it.
Right.
And it cuts the cost down, release the resources for something else. You as a doctor are much more expensive than the trained nurse. Trained nurse is much more expensive than someone else, a laboratory technician. So you need to see both sides.
Right. So the point of this, so this great discussion. So the point is, right, when these first came along, primary care doctors felt like this was competition to them. Health systems felt like this was competition. And maybe it was, right? But the point is that it's a way of delivering safe and effective care so long as they remain within their boundaries, closer to people's homes, right? Not needing appointments and things like that. And in theory, what we'd hope is that that frees up other time for people who really need a primary care doctor, right? Like, think about if a schedule in a primary care doctor's office is filled with kids coming in who really just need their throats swabbed, who really needs to see the primary care doctor is now waiting even longer and longer for the appointments. The idea here is trying to match the right resource and level of intensity to the needs of the patient. And that's a lot behind this sort of the value proposition, right? Do people need, so ear tubes, we do a lot of ear tube surgery in our ambulatory surgery centers. They don't need to come to a hospital and go to the same OR where we can do a heart transplant. Why do I want to fill an OR that can have a heart transplant with ear tubes when the ear tubes can be done closer to people's homes? Yeah. And that's our mix of things, and we can lower the cost and make access better through these innovations. Yeah. Question up here, and then we'll go to the back. Yep.
For example, COVID came to change a lot of these situations. That's
Yeah, so right, so COVID forced, yeah. So
COVID was a challenge, and we as a doctors have to improve the way that we treat patients, the way that we give consults, and the way that the people see the access to this kind of technology. So change
huge, right. So big innovations, right? Like, so COVID was a big accelerator, right, for innovations. Who had things that were already going on in their countries or health systems, and COVID sort of sped it up by 5 to 10 years? Does anyone have like an example where, what type of thing?
Yes, the technology of telemedicine is very poor. It's underdeveloped. And our departments where we do interpretation of CT, MRI, X-ray, whatever, we have been advocating for remote reporting facility with internet connection to the diagnostic computers so that we can report those things at home. But there was resistance by the leadership of the hospital. But when they realized that many of us were infected with COVID, so they were forced to do that. And now they are getting more money because the turnover, the volume is much, and the turnaround time is now getting results faster than before. Right. So I think this is a major shift in our practice, courtesy of the COVID-19 pandemic.
Yep. Yeah. So we certainly don't wish that we had to have a pandemic, but we got a lot of innovations out of it. Yep.
Before pandemic, we also have a good example of disruptive innovation. Maybe cardiologists can explain in more details, but initially when they started to stent, cardiac surgeons were highly against that because they thought it will take some patients from them. In reality, what happened is that they had better prepared patients later on for bypass surgery, because they didn't have to do those difficult cases in acute myocardial infarction. So that's also a disruptive moment, was a disruptive moment.
Yeah. Oftentimes, I think one of the other things you point out is oftentimes the people who are resisting it aren't open-minded enough to realize how it can actually help them, not only in the work they do, but financially. And they're resisting. And when they actually, there are opportunities where a partnership, it could either work better, have a better work experience, or even make more money, or all three. And the people who are sort of creative and open-minded often take advantage of these innovations as opposed to being opposed to them. There's a quote that I heard somebody else say, and I use with my kids, especially when we see things that we're not happy about, is that that people who are fighting these things are fighting the future, and the future always wins. And so innovations are the future knocking on our doors, and we're better off being open-minded, following ways to improve that quality and value experience than to try to fight it. All right, so this is actually a good segue. Does anyone else have a comment? I think I saw. Yep. 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 Yeah. Right. So nothing really new got invented. It was just this whoosh, right? Things that were taking months and months and months, years and years and years. Like, wouldn't it be nice if someday we did this? Where boing, we're doing it, right? And in some cases, we're not looking back. Some places we are. People asked me last night at dinner, like telehealth in the United States. So because most healthcare in the US is regulated at our state level, there's 50 state laws and regulations. And the states are now fighting the future, basically, and that they want doctors to be licensed wherever they're practicing medicine. So like in some cases we have, Trish can remind me of some of these things, like I think New York, is that right? Yeah, so New York, which feels like we're New York, right? Like we have good doctors in New York. If somebody in another state wants to practice medicine on patients in New York by telehealth, they need to be licensed in New York. So they're putting up barriers, right, to this. And there's no national federal law to say telehealth. So all the things that we, overnight states said, okay, you can do all these things. Now they're going backwards. I would say these states are fighting the future. So we have to have our doctors who want to do telehealth on patients who live in New York get licensed in New York. And it's not like that's super easy. New York doesn't, it's not like, oh yeah, please get licensed in New York, right? So, yep. Yeah, and that's a challenge. I mean, it's interesting. We're facing this challenge too. We're like, we really want to have in-person meetings, but then someone's like, yeah, but somebody has to work far away, and it's like we either exclude them or hybrid, and it's. I think what I would argue is we need a next generation of innovation to make the hybrid experience even better, right? Right now, the hybrid experience isn't very good, and somebody either needs to invent or innovate the technology so that hybrid experience feels more inclusive and immersive, as opposed to being so much like those people are clearly on screen and we're clearly in the room. I don't know what that's going to look like. Is that going to be holograms? Is that going to be, something else? But I bet in 50 years it will look different. It could in 5. Who knows? Maybe next year somebody will in this room will have a great idea. So this is a good sort of point to turn to the constraints, right? We started talking about all the good things as well as the constraints to innovation. It's important to know what constraints are because we want to overcome them. So constraints are essentially things that get in the way. Whatever you want, a constraint is something that doesn't allow that to happen. And identifying constraints is very valuable whether you're innovating or not. I was talking the other night with some people, right? Constraints might be funding. Constraints might be how many staff members you have, right? So like, let's say you're like, oh, we could do a lot more surgery. Well, what's the problem? Do you have enough surgeons? Do you have enough ORs? Do you have enough material, right? Whatever else. The thing we don't have enough of is scrub techs, let's say. That's then the constraint. Don't go hire more surgeons. Don't go build more ORs if the problem is not enough scrub techs. And so it's really important to identify constraints. And when it comes to innovation, it's important to identify the constraints so that you can sort of work to overcome them. This comes from a book called Creative People Must Be Stopped, which is supposed to be a funny title, right? Like, we obviously don't want to stop creative people, but it feels that way. Who feels like there's something getting in the way of your creativity at work? Right? Okay, so why do we feel this way? What are the things that get in our way? It goes from individual all the way to technological. So we're going to walk through these. So first, at the individual level, the constraints can be perception, thinking about things, or the expression of ideas. So some people just like they perceive that they can't express their ideas. And I think that connects to some of the things we talked about in the first few days about leading self and leading teams, creating the perception of open-mindedness, figuring out your own styles of expression and communication so that we can reduce those perceptions that you or others can't express their creative and innovative ideas. Intellection is more about like just how one thinks about things, and that can be a constraint. I mean, just people think differently, and some people are able to think more visually or, you know, in words. And so, you know, if a very visual person may not be able to write a creative poem because that's not where their sort of intellect is able to sort of focus. But a very graphically oriented person may be able to design something very differently. And it's not that it's bad, it's just like that's a constraint. And then expression, some people just have trouble expressing what their creativity is. They can have a really creative idea, they just can't quite get it out. And figuring out ways to sort of get those ideas out. That operates at the individual level. Group constraints include things like emotion, culture, processes, and the environment. And so, you know, the emotions people have, you have an idea and everybody's sort of scowling, right? And you're like, okay, well, that doesn't feel like a good state to be in, right? Are people happy or not happy to hear new ideas? How's that sort of expressed? Cultures have different, you know, acceptances around local cultures, we call microcultures, all the way up to you know, societies have different ideas about how different new ideas are expressed and implemented. You know, there's the idea of sort of like progressive versus conservative, and so, you know, conservative cultural ideas, right, will say like, well, we want to make change slowly, and so they may be threatened by a change, whereas a more open-minded cultural sort of lens would say, okay, we're really open to new ideas and being disruptive. And then the processes to bring things along can create barriers, as well as the overall, you know, the environment may be more or less open to new ideas. At an organizational level, there can be strategic, structural, and resource constraints to new ideas. So if the strategy is headed in this direction, right, and you have an idea that's creative that would take the organization in this direction, there's going to be a lot of energy, even if this is a fantastic idea, there's going to be a lot of energy to get the ship that's heading in this direction, heading in this direction. And that's sort of where the strategy becomes important in terms of that. And you know, we'll hear from Brendan tomorrow about strategy and times that strategies need to be updated, right? Like we could set up a 5-year strategy, a creative idea comes along that really points us in an opposite direction or a very different direction, and we've got to be able to refresh that strategy. We can't have the ship keep going in the same direction. The structure of an organization can make it challenging for creativity, and then the resources available, right? You may have a really great idea, and you're sort of like, can I get some funds to try this out? And people are like, no, 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 no. There's no resources for experimentation or innovation. And that can be really frustrating and is certainly a major constraint to innovation. Time, and you know, resources can be time, people, materials. At an industry level, so across organizations, competition, suppliers, and markets may be constraints to innovation. So by competition is if everybody's sort of like competing in the same space and sort of feeling like they have to sort of catch up with the other companies, there may not be much creativity. So has anyone heard of Me Too drugs? No. So Me Too drugs in the United States means that people are making this basically tiny variations on the same drug that already exists. So for example, proton pump inhibitors, omeprazole, right? So like how many more proton pump inhibitors do we need? Like what value is another proton pump inhibitor delivering to the market, right? But the competition, this drug company says, oh look, they made $1 billion with omeprazole. And so we're gonna make another PPI because we think we can go get $1 billion, right? It's like, stop! Like, there's enough. Go cure something that's actually a problem. We have enough PPIs, right? And that's the competition problem. It's like competition working not the way we want it to, right? And so people are chasing the same types of things. Suppliers, you're like, oh, I need something made a different way to be creative, and none of your suppliers can help you. Like, well, how creative can you be if you can't get the supplies for your creative idea? That can be a constraint. You have to go further into what we call the supply chain in order to make your creative idea work. And then the markets themselves, they may not be ready for it yet. There's the example of, this was probably when I was a very young child, but there was the Betamax tapes, people heard of those, right? And then there was VHS tapes. Which was the better technology, from what I heard? Betamax was the better technology, right? But why did VHS win the day? The market, like the explanation is for like, the market just wasn't ready yet. And like Betamax was like too soon, right? For the creative thing. And there's something about VHS that just ended up being better, even though it wasn't the better technology, right? And then societal constraints, people's identity, social control, and history can be constraints to innovation. You can have a really great idea, and if it challenges people's notions of themselves, like as a culture or society, those are big barriers to change, right? People can get scared of that. Control, so when there are certain controls in society, those can also affect innovations and adoption of innovation. And history, of course, like was that a good or bad one? So the history, even at an organizational level, a couple years ago, we had tried out a new product from a company, and it didn't go so well. So we abandoned it after a couple of years, and I felt like we learned a lot. Now, new things come up working with certain companies. And people to this day will say, well, remember when that other thing didn't go so well? I was like, yeah, but that's history. Like, we're not gonna let history repeat itself. We learned some lessons from that, but why is that history stopping us from innovating in a new way? And so history can operate at a lot of different levels, including within an organization, and certainly at a country or societal level. And then, of course, technological constraints, knowledge, time, and the natural environment. I mean, we can only innovate so far, right? Like, are we gonna ever have time travel? I don't know, probably not, but maybe somebody in 30,000 years will stand here and tell you they came from 100,000 years, right? Like, but we don't have the technology to time travel right now, so it'd be great if someone was like, well, I could stop all cancer if I could travel back in time. Great, like that's a great idea, but there's clearly a technological constraint. It can't be done, at least right now. And then time, like you don't have an infinite time to innovate things. So when it comes to innovations, we want creativity, and to some extent, your organizations may vary in that, your teams, your organizations, your cultures. But then there's all these things of like, be creative, but don't be too risky. Don't be too weird, right? Don't make it too difficult, right? It's like, well, you can be really creative, but like it's got to be easy. Well, maybe like, does it have to be easy, or does it have to do something better? Don't be too disruptive, and certainly don't be too expensive. And so those create a number of different constraints on innovation. Now, with all those constraints in mind, how can we encourage our teams, our organizations, ourselves to be more creative? So first off, we've talked a bit about the ideas of psychological safety, the safety to bring up new ideas, that safety of you're not going to get an instantaneous no. the coaching mindset of tell me more about that. I want to hear more. How can we work through those ideas? Even if you hear the idea and you're like, that is way too weird, the response can't be, that's way too weird. Tell me more about it. There's ideas around how one brainstorms, which we'll talk about, and then how to problem solve and be innovative. And the idea is like allow people to be different in order to get these ideas out there. So the first idea is psychological safety. So Amy Edmondson is one of the world's leading experts on psychological safety. If people heard of her or heard of this book. So this is sort of her big book, The Fearless Organization. And I didn't realize it until I was preparing for this talk, and she actually spoke at Penn last month on her new book that's coming out. But the subtitle of her book is Creating Psychological Safety in the Workplace for Learning, Innovation, and Growth. Did you know that was in her subtitle, Scott, you knew that? Yeah. So I thought it was really interesting, right? Like we focus on the fearless organization and psychological safety about interactions, but she emphasized the idea of innovation. And so what she says is that leadership that builds psychological safety and innovation is part of this idea of the fearless organization. And that what you want to do is framework that call attention to work that requires mutual learning, right? So how can people work together? Like, not only foster that, but really like call attention to it. Say, isn't it great we got these people talking, like the innovations that came out of that. We're bringing people together to think through ideas. We're being really purposeful about getting people with different perspectives to think through ideas. Invite participation, so use inquiry, the coaching mindset, ask questions more than make statements, put on your OWL, flex into OWL in terms of that. And then responding productively, which is basically it's okay to fail and appreciate that, right? Like safe modes of failure. And in healthcare organizations that have research components, how much research, right, lab-based research succeeds the first time? Not a lot, right? Like we have research labs doing work, like they're trying things over and over and over and over again, right? And so like we have a research building where we're funding, I sort of joke, we're funding failures over and over and over again to get a success. Then we walk over to the clinical areas and we're like, let's try something new. And there's no room for failure. Can you guarantee me that will succeed and save money by next month? No, I can't. Well, then don't try it. Okay, I guess I'll keep doing things the way I used to, right? So we have to sort of appreciate and allow for safe failure. We're not experimenting on patients, right? We can't make it dangerous, but we have to have some room for trying new things and failing. When it comes to brainstorming, again, a lot of what we've already talked about, so deferring judgment. If you're in a session where we're trying to get ideas, and it's a brainstorming type of thing, it's like hold back on judgment. Encourage wild ideas. There are exercises people can do if you really want to get into this. Like you ask people to do some unrelated task, right? They come together and you're like, okay, we want everyone, like here's a bunch of things on the table, like assemble these things into a project for 10 minutes. Now let's think about how to improve patient flow in the clinic. That task had nothing to do with improving patient flow, but that task makes everybody's mind sort of open up in a different way. Build on the ideas of others. This is a lot of what Scott talks about with the word "and." Like improv, what's the people know about improvisation? They're like comedians who are improv. So the major rule of improvisation is "and," not "but." Like if you ever see a comedian like improv, it's like they never say like, my uncle came from Mars, and somebody else is like, but that can't be true, right? Well, the joke ends, right? But it's like my uncle came from Mars, and all his food is red or something like that, right? Like I'm not an improv comedian, right? But the point is like keep it going. You say but and it ends things. So like someone says something, build on it, right? One conversation at a time and be visual. So, whiteboards, get in rooms where you can draw things, on screens, draw things. It's really important, like model things out in order to be creative. Divergent thinking is where you have a stimulus and you get a lot of different ideas. And it's really important, right, to get the idea out there and not converge on a solution. Keep with the ends. Okay, here's what we're trying to solve. We're trying to solve patient flow in the clinic. I have an idea. Don't say but. And what else could we do? And, right? Then convergent thinking is, now we have some facts. My idea is to add 3 new doors to the building. The fact is, it's concrete walls and we have no money for more doors. So that might be a good idea, but right now the facts constrain that idea, right? The environment constrains that idea. What else could we do? Coming towards an answer. And so these phases of change of innovation is identify the problem, generate ideas with this divergent thinking, assess them and the constraints, set a direction. You may need again, so okay, now we're focused in this direction, let's brainstorm again and then bring it back together again. And this can be a repeated process of divergent, convergent thinking where you finally refine the issue and try to implement it. Now, implementation may also have opportunities for, okay, it's going a certain way, do we need to make some modifications? And then, are you in sort of more of an improvement zone of, we're going to keep doing the same thing, but we're going to keep improving it. PDSA cycles, if people have taken the quality improvement courses, plan, do, study, act, more of an improvement type of idea, not divergent thinking. Linda Hill is another Harvard Business School professor, and she talks about this idea of collective genius, of trying to get sort of the collective genius out of your organizations. And so what she says is that a different kind of leadership is needed for innovative problem solving. She wrote, great leaders of innovation see their role not as taking charge direction setters, but as creators of a context in which others make innovation happen. Again, the coaching mindset, the end. It's not that I have the idea necessarily, it's that I'm creating my idea is to create an environment for new ideas, creative solutions. And what she identifies as 3 key factors in her research. One is what she calls creative abrasion. Heated but constructive approaches that go even beyond brainstorming. So Scott was talking about like 2 eagles, and other people think it's an argument. That's creative abrasion, right? It's like, it feels heated, but it's not. It's like we're getting things out there. And owls could be a version of creative abrasion, like lots of questions and like abrasions, kind of like friction, right? Like we're heating things up, we're stirring things up, but the idea is to get these ideas out there moving. Creative agility, testing and refining, design thinking, so this idea of design, right, where a lot of that can be sort of graphical, right? Like, what do customers want? How do we design things better? Like, what makes Apple products so remarkable? The design, right? Like, they're in and of themselves beautiful for what they are, right? And so this design thinking, and there's this idea that we want design thinking in other of our interactions. How can we design an office to feel beautiful to the customers, that they can move through the experience? That doesn't necessarily mean spending a lot of money, right? Like, I need a registration desk one way or the other. Is there a way I can design the desk to be more inviting, to make, for the customer of the patient, more user-friendly for the staff member, thinking about that registrar as a customer of us as their employer and of the desk? And so design thinking. And then creative resolution. Decision-making to new combinations to produce new and useful solutions. And so this is where, again, this idea of like, it doesn't have to be a brand new invention, but it's this resolving these ideas and saying, okay, we bring things together in a different way, and that has new value for our customers. I think I saw a hand go up somewhere. Yes, Karina.
I think that creativity is something that can't be, you need time to be creative. You
Yeah.
can't just say, I want you to give me an idea now to be creative right now in this room to have something.
Yes. Yep.
So I think that first you need inspiration
Right. So it's a great point, and so people can hear it. You need time. So I think one of the things we have to figure out is like for ourselves, blocking that time for getting work done, creative thinking, often being very purposeful. This meeting is about creativity. We're setting this up, right? The agenda for this meeting is brainstorming. Come for that kind of thing. So yes, you have to be purposeful about that. It's not really surprising people. Also, like I've been in meetings where like we have these huge meetings and then people are like, okay, let's be creative. It's like, well, you didn't set anything up for that. In fact, like you have the boss of the department here and the boss made some opening statement. It's like, well, I don't even know why we met. Like, why did we keep meeting? Like nothing creative is gonna come now. And so you're 100% right. That doesn't mean you have to go for an off-site retreat and spend 4 hours, right? It's just being purposeful and saying, I want us to come together. I want the right people to be here. And we're gonna have this sort of experience to try to be creative purposely and use these kind of tools. All right, we're at time. And so I think the last thing is, right, creativity and innovation can be facilitated by a culture, safety, and a different leadership approach. And the time I should have spent, is important in that. That leadership approach has to be to create all these things as well as the time for that creativity and innovation to happen. And the experience of doing it builds on itself and it becomes a cycle. And if you're really creating that culture, people will appreciate that and enjoy the times they can be creative around that. All right. Happy to keep talking at lunch, but we're going to break now so we can enjoy our afternoons. Thanks, everyone.